Hello and welcome to the presentation all about balance. Your presenters will be Rachel and Alexa, who are both occupational therapists registered in the province of Ontario. This virtual program is based off a 5-week Boosting Balance and Bone Health program. The information from this program is based off of best clinical practice guidelines, including the Ontario Osteoporosis Strategy. We encourage anyone who wants to learn more about bone health and improve their balance to participate in this virtual program, as the information is also relevant for the general public. There are accompanying exercise and education videos with this program that are available on these websites and Facebook pages.
So, what is balance? Balance is the ability to maintain the body's center of mass over its base of support to keep upright. Our center of mass can be referred to as our body weight, and our base of support refers to how wide our feet are on the ground. When you put that together, balance is essentially the ability to maintain control over how our body weight shifts when we move around or change the position of our feet. When balance works properly, we can see clearly while moving, identify body orientation with respect to gravity, which means that we know where our body is when we are moving, identify direction and speed of movements, and adjust posture during movement and activity to keep our body stable. For example, if we are walking up a flight of stairs, our body position will naturally change to bend slightly forward to adjust for the change in position in order to keep our body stable as we move. How does balance affect us? A change in balance is often the reason why an older adult falls. Balance is often impaired as we age due to changes in our body. So, what in our body affects balance? Think back to your everyday life of some examples where you sometimes may have slightly lost your balance. Maybe it happened when you turned too quickly, or when you were trying to go up or down stairs, or when you were walking outside and suddenly had to avoid an obstacle like a rock on the ground. For each person, the reason may be different as to why we lose our balance. There are many different factors that can contribute to a loss of balance, and various body systems that control our sense of balance. It is important to know what these systems are and how they interact, so that we can better understand how our balance may be affected. There are 4 systems in our body that work together to control our balance. The visual system, which is the ability to see with our eyes, the vestibular system, which is a balance center in our inner ear that provides information to the brain, our somatosensory system, which includes the nerves that provide tactile feedback, and our musculoskeletal system, which includes our muscles, tendons, and bones. Whenever we have a change or an impairment in any of these systems, it can affect our balance. Included in these systems are the balance sensors, which communicate information between each other throughout our body. These sensors include the brain, eyes, inner ear, muscles, joints, and our sense of touch. When there is a disruption in the ability of our body to communicate the information from these sensors, our balance can be impacted. Let's now go into each system in detail and how it can affect our sense of balance.
First, we will talk about the visual system, which is your eyes. The visual system is usually one of the most obvious associated with balance. This system works to help you see where your head and body are located within the world around you, help you to see the environment move as you move, identify barriers, hazards, and pathways, recognize objects and detect motion, and see changes in terrain or uneven ground. Next, we move to the vestibular system, which is a system often less recognized as being associated with balance. The vestibular system is in your brain and inner ear, and it can detect head movements like nodding or turning your head, forward and backward, as well as up and down body movements, the location of the head with respect to gravity, for example, when you're tilting, leaning, or lying down, and the acceleration and deceleration of movement. Overall, detecting body position and movement really helps you to make adjustments to keep balance.
The somatosensory system is a body system that provides input about the world around you. It includes sensors in the muscles and joints of your body that send information back to your brain about the movement, speed, and location of your body parts in space. This means that even with your eyes closed, if you move your arm above your head and wave it side to side, your brain will know where your arm is at all times because of these sensors. This system is also responsible for sending information to your brain about how fast your limbs are moving. This helps to keep a good, steady pace when you are walking. And finally, the direction in which you move your body is also sent to the brain from this system, which helps you keep track of how you are moving your body when changing positions. The musculoskeletal system includes the bones, tendons, and muscles in our body. This system is responsible for the strength that keeps our body upright to maintain our balance. The ability for the system to work properly depends on various factors. This includes having strong bones to support good posture and a stable body position, having enough muscle strength to keep ourselves upright and move with stability and control, and the ability to react by moving our body or changing posture when a loss of balance is detected. Normally, this is the system that we think of when our balance starts to be affected. However, as you have just learned, this is one of 4 systems that work together to maintain our balance. All of these body systems make a unique contribution to maintaining balance. As you can now see, when one of these 4 systems isn't working as usual, our balance becomes affected. It may become more difficult for us to balance when we turn directions, move around, or when we try to stand up. The risk of losing our balance can increase if one of our systems becomes impaired. This is why it is important to have a good understanding of the changes in our body and consult our primary care provider as needed when we might experience any of these changes.
I'm sure you have been told that exercise is important, but it's important to also know why and what kind of exercise is best suited to your needs. It can help reduce bone loss, conserve bone tissue, improve your physical fitness, improve your muscle strength and reaction time, improve your sense of balance and coordination, and reduce pain. Let's now look at what types of exercises are available and some different examples of them, things that you can use in your everyday life. There are various types of exercise, and they all work together to strengthen your bones and muscles and support your various organs and body systems to keep you healthy and fit. First of all, we have weight-bearing exercise. This helps to build bones and keep them strong. Examples include high-impact exercises such as dancing, hiking, jogging, or jumping rope, and lower-impact exercises like elliptical training, low-impact aerobics, fast walking, or treadmill walking. For anyone at risk of or with osteoporosis, it is the low-impact weight-bearing exercises that are recommended. Muscle strengthening exercise is another type, and this helps to improve and maintain muscle mass and strength, increase spine and hip bone density, and strengthen bone overall. Examples of this include lifting weights, using exercise bands, using weight machines properly with correct training, lifting your own body weight, and functional movements. For example, standing up from a chair, doing the stairs, and things like this.
Other types of exercise that are important to improving or maintaining your balance include actual balance training and regular stretching. By practicing and training your balance, you can improve your muscle coordination and reaction time. The goal of balance training is to become accustomed to different positions that may place you slightly off balance, but then learn to find balance in these positions and react appropriately to slight offsets of balance. This type of training will help reduce your risk of falls and fractures. Some good examples of balance training include Tai Chi, simple balance exercises, and low impact dancing. If you need some ideas on what simple balance exercises are, check out our balance exercise video included as part of this virtual program. Always make sure you have a chair, table, or other stable support to hold onto when you are training your balance. The last type of exercise that is important to improve or maintain your balance is stretching. Although this is not typically viewed as exercise, stretching is important to practice daily. It helps to improve and maintain muscle mass and strength, increase spine and hip bone density, and can help to strengthen your bone. Good examples of stretching include gentle yoga and simple stretches. As we age, we can lose flexibility in our muscles and joints, which contributes to increased pain and stiffness. This is why regular stretching is vital to maintaining good posture and flexibility. Whenever you are going to begin an exercise program, it's important to think about the why. What goal do you want to achieve with this program? If you have a set goal in mind, it makes the journey to get there more realistic. A good way to set goals is to use the SMART method, as pictured here. SMART stands for specific, measurable, achievable, realistic, and time specific. Now let's look in detail at how these factors help us make a good goal. The S in SMART stands for specific. We want to set a specific exercise or activity for the goal. The overall goal may be to improve our balance and strength, but in order to achieve this, we have to decide on what activities and exercises will get us there. We also want to make sure that our goal is measurable. So a good example to do this is to use the time spent doing the activity or length in meters walked.
We also want to make sure that our goals are achievable. This means that you're going to be able to achieve the goal with moderate difficulty. The goal should not be so hard that you struggle to complete it, but it should also not be too easy that it does not pose as a challenge. So it's really about finding that balance. Goals should also be realistic, making sure that the goal that you create is realistic to your own body strengths and your free time. If you have a busy schedule and aren't used to exercising regularly, you want to be careful to not set too much on your plate all at once. The last part of our SMART acronym is time specific. So you want to make sure that you have a set date or time period when you would like to achieve the goal, making sure that you give yourself enough time to achieve the small goals so that the large goal is easier to attain overall. Now we're going to have a look at an example of a SMART goal to help you set your own goals. So, to give you an example of a SMART goal for this program, you could say, my goal by the end of this program is to improve my sense of balance when changing directions. To achieve this, I will perform 3 different balance exercises, shifting weight from foot to foot, turn and change direction, and stepping over objects. I will do this 4 times a week while brushing my teeth. As you can see, this goal incorporates all 5 parts of the SMART acronym: specific, measurable, achievable, realistic, and time specific. Our hope is that everyone who participates in this virtual exercise and education program will make their own SMART goals to better help you improve overall strength, balance, and knowledge of the importance of exercise on bone health and overall quality of life. In turn, this should help motivate you to continue the exercises provided at home on a regular basis.
Thank you for watching our presentation all about balance, which is the first education video of the virtual Boosting Balance and Bone Health program. If you have any questions about the content of this video or would like to learn more about the program and access our exercise videos, please go to the websites or Facebook pages of the organizations listed here.